I'm Roger Baker, Executive Director of the Stratfor Center for Applied Geopolitics at RANE, a global center of excellence for geopolitical intelligence and analysis. Learn how you can put geopolitics to work for your organization at ranenetwork.com.
Welcome to the Beyond COVID podcast from RANE Network. In this podcast series, David Lawrence, founder of RANE, speaks with Dr. Fred Southwick, an infectious disease specialist at the University of Florida's College of Medicine, and Dr. Bill Lang, an expert in public health responses to biological incidents, about the current state of the COVID-19 pandemic. Let's listen in on this week's conversation.
Fred and Bill, thank you. This is a little bit of a special edition of Beyond COVID to talk about obviously something that's received a lot of media coverage, which are the smoke conditions that came in from Canada into the United States as a result of the wildfires, and a lot of commentary about this being also part of the new normal. And I know from our conversations, both of you have been very thoughtful about some of the applicable lessons from COVID that are transferable to these types of situations, both in terms of preparation and response. So I thought it'd be great just for the audience to begin to hear some of the insights that you have and what you can share. And Bill, I know in your work at Homeland Security, you had some experience with precisely this kind of issue. Maybe we'll start off with you.
Sure. Well, thanks, David. At Homeland Security, the FEMA comes under Homeland Security, and FEMA is dealing with wildfires, essentially every year. So I spent a lot of time working with my deputy at the time was an industrial hygienist. So I got a crash course in the health effects of wildfires. A couple of important things to start with is that the wildfires that we're currently experiencing from Canada, apparently the fires themselves are starting to be knocked down, and the prevailing winds have carried most of the dangerous smoke and smoke byproducts, wood burning byproducts out of the northeast, and they're carrying them into the southeast. Now, just because of the distance and diffusion, it's not as bad in the southeast, but some of the same considerations come to play. This also gets back to our normal subject, which is COVID, because just 3 weeks ago, the CDC put out new indoor air quality guidance. For the first time ever, they issued recommendations for the minimum air exchanges per hour in commercial properties. That number is 5. 5 air exchanges per hour is typically less than most modern buildings already achieve, and certainly with COVID, where buildings learn to maximize their air exchanges, they're ahead of the game on the recommendation. CDC also said that the 5 air exchanges per hour are typically adequate for other air quality issues. So they were a little bit prescient on that in terms of getting ahead of this current. But the key thing, one of the key differences, however, is that with COVID, we always said you need to maximize your outside air intake, your makeup airflow. Most of your air exchanges should be literal air exchanges, bringing in outside air and getting the potentially virus-containing air to the outside. With things like wildfire smoke, it's kind of the opposite of that. You want to minimize your fresh air intake and maximize your air filtration with recirculation. So that's something that the HVAC experts will get into. But that's the key thing is you want to get, if you're in a modern building with modern HVAC where they can tweak that a bit, you're probably going to have the safest air exchange being in a building. I know there was a lot of concern, should people go to work with this bad airflow, or the bad air coming from the fires? Well, the reality is, if you're in a modern, even a reasonably modern building, office building, that's probably safer even than home, where home, the only makeup air you're getting is air that's coming straight from outside, and there's typically very little filtration. Speaking of filtration, one of the big problems with the wildfire smoke is the particulate matter. Some people have said that the particulate matter in wildfire smoke, if you're out in that for an hour, that's the equivalent of smoking 8 to 10 cigarettes. Well, the good news there is that a high-quality mask, an N95 mask, or even a well-fitting surgical mask, well-fitting being an important consideration, can filter out most of the most dangerous particulate matter. But if you've been out in this smoke with a mask on, you'll notice that you still smell it and you still maybe even taste it after a while. Well, that's because it's not just particulate matter. There's also volatile organic compounds that are in there. Those have some danger, but nowhere near as dangerous as the particulate matter that creates a cigarette smoking like condition, because it's the same thing. You're burning plants and then inhaling those burning plant byproducts. So a mask can be very helpful. Just don't expect that it's going to eliminate any side effects, and your clothes are going to clearly smell like you've been in a wood fire. The one other consideration that businesses and even people at home should have is that portable air filters that many people have put aside, maybe even thrown out, bring them out again. Check the filters, replace the filters, do whatever servicing you have. But an air filter, that a portable air filtration device that has good filters and is sized appropriately to the space you're covering can be very, very effective. Many commercial buildings, people that I've been working with a bit, they've brought their portable air filters back out and they're running. Again, it's not going to filter out all of the volatile organic compounds, so you're still going to smell it, but it's going to filter out almost all of the dangerous stuff. Plus, many of the portable air filtration units have charcoal filtration, and the charcoal filtration will also help to filter out the volatile organic compounds. So I've been talking for a while. I should shut up now.
Well, Bill, you're an expert on this. I can just say that the M95s will filter out a lot of the most harmful, but there are fine aerosols and organics. You were saying under 2 microns. Remember the COVID, the aerosol was usually 2 to 5 microns, and the filters worked reasonably well, probably 90-95% clearance, and therefore dramatically reduced the infectious rate. In this situation, you'll get the larger particles, but you will still get the finer particles will come through. And I agree with you. Fortunately, I do still I decided to keep my indoor air filters running all the time, because there is always influenza and other viruses that could be transmitted inside. So why not continue with those filters? So I agree with you. The inside filters, and particularly with this smoke, will be very, very helpful.
So once again, there was also a question of information. Where can people go? What information can they rely upon? I think, in fairness to our political leaders in the greater New York area, the spread of the smoke and the what I'll refer to as the degree of the smoke condition caught everyone by surprise. And so I think it'd be great, no different than during the period of COVID. Where can people go when they do have concerns about the quality of the air and how they should check it and begin to think about the risks of going outdoors, whether to wear a mask or not wear a mask, whether to put an air purifier inside their home, etc. Do you have any guidance for the audience?
That's a little bit tough, because other than sources like this, many of this typical public health providers, public health information providers, take so long to give information together that by the time they are putting the information out, the incident's over. A good source for local air quality is the standard commercial weather providers. Both AccuWeather and I should say all three, AccuWeather, Weather Underground, and weather.com, all have on their website using various sources. They have a score. They use different scores, it's not as standardized as it is with other aspects of weather, but they'll give you an idea of whether it is dangerous to people who have respiratory conditions or other health conditions, or is it something that everybody should be minimizing? In New York City, for the past couple of days, the recommendation has been everybody should minimize. You get down to D.C. area where I am, or now down in the Southeast, what they're seeing is the recommendation, the levels that they're seeing, the recommendation is for those people who have any type of respiratory condition should make sure they are protecting their source of air, whether it's staying indoors or wearing a high-quality mask, which has its own problems, of course.
Yeah, I should point out that in Florida right now, I use the Apple Watch. Actually has a weather, and the air quality for Gainesville, Florida, is 41, and I understand that in New York, Dave, that it was up to nearly 500. Indicating how severe.
It was on Wednesday. Absolutely right, Fred. Correct.
And that's almost income. I mean, that's a very dangerous, real severe health hazard.
And I should point out, I'm glad you guys are mentioning some of the commercial, whether it's the Apple Watch or the different weather services. When they give you an indication of the air quality, they usually have a ribbon, and maybe sometimes I've seen it color coded. To indicate sort of safe, moderate risk, high risk, etc., and which I at least found helpful. I didn't know about the spectrum until I had to search, because the information coming out of official sources, as you said, Bill, was it's not yet been built out, but hopefully from every one of these incidents, there's a learning scale. Fred, from your standpoint, maybe you can explain to people why these types of conditions must be taken seriously. And it's funny because on the streets of New York, where I am, I heard a number of people remarking that they really they were enjoying the smoky smell of the air. It was like being in front of a fireplace. But in any event, maybe you can share with people why they need to take this a little more seriously.
Sure. Yeah. The particles are fairly small, number of them, and the smaller they are, the deeper they can get into the respiratory tract. So if you take a deep breath with this kind of fine smoke, certainly the larger particles will get down into the lower bronchi, but then the finer particles, the 2 to 5 microns, can actually get all the way to the alveoli, the gas exchange parts of the lung, and cause inflammation. And then inflammation can cause bronchospasm. So the bronchi have smooth muscles that when there's inflammation, they can get irritated and then spasm, and that can give you an asthma-like attack with wheezing. And certainly, if it's prolonged enough, you can get permanent damage, and that's what happens with the patients that smoke, is that the inflammation continues for prolonged periods of time. Theoretically, you can get bronchitis or chronic obstructive pulmonary disease. Now, that would take years, so I don't think that we have to worry about that, but I do think that asthma, sudden onset of shortness of breath, you should take seriously, and some people will need bronchodilators when that happens, and may actually have to seek medical attention, because your oxygen levels can go down significantly if it's severe bronchospasm.
And Bill, taking away from your conversation, it sounds like the new normal, people should hold on to their masks, obviously pay attention to the broader environment, and sometimes commercial services as well as some of the leading medical sites are good places to check. And the importance of having some basic equipment inside the house as well, air purifiers, and whether, Fred, as you said, for COVID purposes, but also for these types of conditions can be very, very helpful. And it sounds as though a number of good lessons coming out of COVID need to be remembered, and certain basic equipment that one can have in the house can prove very, very
David,
important.
I think it is worthwhile mentioning that those are the people who are listening who are maybe east of the near the Rockies or east of the Rockies, or west of the Rockies, I should say. They're listening to all this and thinking, what are those damn Easterners worried about? We deal with this every single year.
I was going to ask, right, this is where you stand on this issue depends upon where you sit. And yes, we got it once, and we're it's headline issue, et cetera. And the people in the mountainous areas, and Colorado's had a fair share of fires, and you had situations in Arizona, and the people in Australia have been dealing with this, and obviously California and Washington and Oregon. Correct, you are right. This is a somewhat new experience for the Northeasterners. Good point, Bill. But nonetheless.
It's still all worthwhile keeping in mind, and for everybody out west, that it's not without risk. It's just a risk that can be managed.
And David, as we've talked about many times, disinformation played a huge role in COVID-19. Well, disinformation with regards to global warming is having a huge impact on all of us, and our children are very upset that we've allowed this global warming to continue without sufficient action on a global level because of disinformation.
And probably some lessons just to balance everything out in forest management, which has not necessarily received sufficient funding or approvals. So one of the things I was talking to some people up in Canada. The ability, first of all, the fires up in Canada reportedly have been raging since March, but have been highly inaccessible for various firefighting services to reach. So some lessons there as well, Fred, but very, very good points. All right, Bill, we'll toughen up here in New York, okay? We're 8.5 million people living in a relatively dense environment, and it did look like Mars on Wednesday here in the city. And I will say, when people can't see the Empire State Building, they tend to freak. So that was, part of the zeitgeist.
There's also some thought that the degree of particulate matter in the atmosphere is enough that it's actually caused unseasonable cooling in the Northeast. Probably not enough to have any long-term effects or even intermediate-term effects, but it is cooler than would otherwise have been anticipated for this time of year.
As it was before, so we'll leave it. So again, Fred and Bill, thank you not only for the time, but the calm and common sense approach to our health and medical risks and things that are evolving as our new normal. So until next time, again, with tremendous gratitude for your insights.
Thank you, David.
Thank you, David.
This is the RANE Insights podcast, which is part of the RANE Insights series, comprised of both virtual and real-world events, offering unique practical perspectives from RANE's leading experts in risk management. To learn more, please visit us at ranenetwork.com. That's RANE network.com. Thanks for listening.